Welcome to the American Institute of Healthcare Professionals Videogram on ADHD. We're going to be discussing what ADHD is today and also introduce to qualified professionals our ADHD Consulting Certification program. I'm not an author of any of the courses, but we do have instructors who are qualified to teach this type of subject, and they lead you through the various modules that you have to take to become certified, which is a 4-year certification like all of our other programs that we offer. So in this video, we're going to discuss what is ADHD, just to give this a little bit of a basic idea, and then go over some of the details regarding the program itself. ADHD actually refers to attention deficit hyperactive disorder. It's a neural developmental disorder that can affect children and adults. It can either be just focusing on the attention aspect, the attention deficit, or it can also affect merely the hyperactive element. Or you can, an individual can have both symptoms of the disorder itself. Few quick facts here we have listed. 6.4 million children between the ages of 4 to 17 have been diagnosed a year with ADHD. 11% of all American children have ADHD. The average diagnosis age is 7, and boys are 3 times more likely to have ADHD. If you look at the final fact that we have listed, the final statistic, 4% of American adults also have ADHD. So it's just not a disorder that affects children, but it also affects adults. Various symptoms for those who have ADHD include trouble concentrating, difficulty staying organized, forgetful about completing tasks, difficulty sitting still. And the difficulty with sitting still is more an element of the hyperactive disorder. Boys with ADHD tend to be more impulsive, hyperactive, and inattentive. Girls tend to be more withdrawn. They exhibit more anxiety, daydream, and also tease. Consequences of ADHD include academic scores that are not up to par, problems at school, problems at home, peer issues and antisocial behaviors that manifest from it, which eventually can lead to also juvenile issues with the law. Many times also ADHD coexists with other learning disabilities or problems, including anxiety, depression, sleep disorders, substance abuse, and in younger children, bedwetting. Adults with ADHD also have various issues that correlate with their level of position in life. Struggles with relationships. Many individuals have a hard time maintaining a relationship with the opposite person, and breakups are very common with their partners. They have issues keeping their home organized. They have an issue keeping their checkbook balanced. Finances are a constant pain for them. And they also have problems at work. So what is at home and within their relationship follows them to the office or the assembly line. ADHD medication is one option that can be taken. A study from 2007 states that per individual, $14,576 are spent on medications alone, with $42.5 billion being spent on the nation as a whole. The major medications that are usually prescribed are Ritalin and Adderall, and these medications target the neurotransmitter dopamine. This is closely related to the area of the brain that works with the ability to be attentive, the ability to be focused, and so forth. With these drugs that work on the mind, sometimes there are side effects as well. Loss of appetite, sleep issues, weight loss, and also irritability. However, behavioral therapy is an excellent option to supplement medication, or maybe even completely replace it if the side effects are too strong. Various behavioral strategies look to improve problem areas in the mind that focus on organization and impulse control. With children, therapists and parents can also set various goals to help be accomplished with completion of homework, chores, keeping a room clean, and exhibiting better behavior at home and in school itself. Adults utilize a type of behavioral therapy called cognitive behavior therapy. And this type of behavior teaches the adult to recognize the thoughts of ADHD that will later affect their behaviors so they can identify it and then react differently than what they normally would have before diagnosis. And this is pretty much emphasizing diagnosis is key. If you go throughout your whole life without being diagnosed with ADHD, you'll never know why you behave a certain way, why you can't organize, why you can't stay focused. Your partner might feel the same way. And then upon the diagnosis, a light is turned on and an understanding and an ability to change. It's also extremely important to diagnose your children, especially if your household is chaotic because of the ADHD symptoms that are running wild in your child. So knowing the issue helps change the behavior, whether a child or an adult. And again, this is why it is so critical to find diagnosis. AIHCP, as I said, offers an ADHD Consulting Certification program. The program consists of online and independent courses. You take the core courses, and upon completion of each course, you receive a certificate for that course with CE hours. Upon completion of all of the required courses for the program, you can then apply for a 4-year certification in attention deficit hyperactive disorder consulting. Individuals that we look to certify, individuals that meet our prerequisites, are usually healthcare providers or those in the behavioral health field, also individuals in the teaching fields, and those who have at least undergraduate degrees in psychology or types of counseling. If you would like to find more information on our ADHD Consulting Certification program, you can refer to the link to our page, as well as a request for information link that you can fill out, which goes directly to our office. If you'd like to talk to us in person, feel free at 330-652-7776. Again, it's 330-652-7776. You can also email us at info@AIHCP.org. So again, if you're a professional in healthcare, if you're a professional in behavioral fields, and you would like to offer ADHD consulting to various clients and patients, this is a program definitely to look at that will enhance your knowledge of the subject and also teach you the skills to help others with ADHD. I'd like to thank you for listening today and have a great day.